The Association of Surgeons and Health Ministry recently dispatched over 300 expert surgeons to Ankole to carry out key surgeries, free of charge. Most of those we found gathered at the Mbarara City Council Health Center were relieved to be able to access specialized surgical procedures. This facility, 50 expert surgeons are on duty in what to many is a rarity.
Actually, we have the neurosurgeons, those working on the brains have started off. Those working on the very young children are also working. We have the ear, nose and throat also in theater. We have the urologists working on the main issues are also on board. We have what we call the plastics and reconstructions. Those who are working on things like the burns, the cone fractures, the big scars, the ugly scars. In other words, the people who are putting someone to look so nice in the face and everywhere, all those teams are on board.
2 days into the camp, the numbers are already overwhelming, a sign of desperation for better, since many cannot afford these surgeries that cost millions of shillings, depending on how complex they are.
We are failing to get now where to pay to the patients, but we are working around the clock to improvise ways where we can put the patients. And we are also trying to create another site or station where we can operate. So we are enlarging our scope of operating. We are creating an additional operating theater in one of our affiliates. The hospital is giving us space, and hopefully by tomorrow we shall be having mainly about 90% of the subspecialized services.
Harison Kagure is the PRO of Mbarara Referral Hospital.
Today, this morning, big number of patients have continued to power in, and we are also telling them to be a little bit patient because they need to first see the doctors whom we have dispatched to different wards in the outpatients clinic to be assessed and then booked for surgeries in line with their conditions. So we are calling up because they have started making some, can I call it, necessary noise.
Claire Charikunda, a caretaker of a patient from Rukunjiri, is one of the over 200 people who have turned up for free surgery procedures.
We would like government to consider bringing these services to Nyachibare in Rukunjiri. This because we spent so much on transport and accommodation to come to Mbarara for such services.
The operations, which started yesterday, will continue until Sunday.